Hello students, I am Dr. M. Yasvanthini, lecturer, Department of Physiology, School of Allied Health Science, Salem, Vinayaka Missions, deemed to be University. And today we are going to see the topic blood pressure and its regulations. Objectives. Today what we are going to see. We will see about the definition and types of blood pressure, then what are its variations in physiological and pathological variations, what are all it is there, and you will understand the physiology and regulations of BP in this. In regulations you will see the receptors, what are all the receptors present and what are all the angiotensin mechanisms present, and we will learn to record the method of accurate BP measurement. Then we will discuss about the clinical conditions related to the BP abnormalities to explore prevention and management strategy. In 19th century, Jules Harrison coined the name sphygmograph. Then in 1905, Dr. Nikolai Korotkov in the year 1874 and to 1920, a Russian surgeon, he coined the term a simple and precise technique to measure the arterial pressure. Then the Korotkov described 4 distinct phases of sound, but he failed to notice only the muffled second sound, which was demonstrated a little later. Then we will come on to the definition. What are the definitions of blood pressure? How will you define blood pressure? We will define blood pressure as the force exerted by the blood on the vessel wall per unit area. Then in clinical practice, blood pressure refers to the arterial blood pressure measured in millimeters of mercury. That mmHg relates the millimeter mercury. It is the value of the blood pressure. Then a typical BP reading includes what all in BP measurement, what all you will see. First we will see the systolic blood pressure, and the later you will hear the sound of diastolic blood pressure. Systolic pressure will be heard during ventricular contraction and diastolic pressure will be heard during ventricular relaxation. That time your ventricle will be in the relaxed state. In systolic, your ventricle will be in the contraction phase. A normal BP will be approximately, coined to the normal terms, is 120 by 80 mm of mercury, that is millimeter of mercury. This is the normal value, 120 by 80. Then we will see upon the types of blood pressure. What are all the types of blood pressure present in the blood pressure units? Then here what we are going to see is depends on the nature of the vessel. Nature of the vessel means whether it is arteries or veins or capillaries. Depends on the nature, it is divided into arterial blood pressure, venous blood pressure and capillary pressure. Then coming on to the systolic blood pressure. Systolic blood pressure is defined as the maximum pressure exerted in the arteries during the systole of the heart. Systole means contraction. During the contraction of the heart, what are the pressure exerted in the arteries? That is defined as the systolic blood pressure. Then that is the normal value. What will be the systolic normal value is 120 mmHg. Then we will come on to the diastolic blood pressure. After systole, you will come on to diastole, that is in relaxation state, when the ventricle is in the relaxed state. So in diastolic blood pressure, or a definition, what do you mean by the definition is minimum pressure exerted in the arteries during the diastole of the heart, that is in the relaxation of the heart. That the normal value will be 80 mm of mercury, millimeter mercury. Then we will come on to the pulse pressure. Pulse pressure is the difference between the systolic and the diastolic pressure. Then the normal value will be 40 mm of mercury. Today now we have seen what are the 3 blood pressures: systole, diastole and the pulse pressure. Systole means during the contraction and diastole is in the relaxation. Then pulse pressure is the difference between the systole and the diastolic pressure. Then we will see about the measurement of BP. How you measure BP? There are 2 methods in measuring BP, that are the direct and the indirect method. What we are using is indirect method. In indirect method there are 2 types of method, that is palpatory method and auscultatory method. Palpatory and auscultatory. Then in direct method we use the electromanometer for measuring BP, a transducer that converts mechanical energy into an electric signal. The artery is cannulated with a saline filled catheter or needle that mechanically couples the circulation to the arterial manometer. Then the pressures are noted using atmospheric pressure as the zero reference level, and intravascular pressures are further reference to the level of the heart by addition or subtraction of the gravitational factor. These are the direct methods. Then in the indirect method, what we use for the non-invasive evaluation, this is the non-invasive procedure. For non-invasive evaluation of atrial BP, the pneumatic cup with a mercury or aneroid manometer is the most frequently used technique. Okay, this is the method we use frequently. Then these are the instruments we use for measuring BP. This is the automatic inflation cup. In this we no need to pressure the cuff, but we can use it by, this is the electrical method. Just we have to tie the cuff and you can switch it on to the manometer, then it will give the reading. But this is the sphygmomanometer. This is the manual methods used for measuring BP. In this, the whole procedure have to be done by you, but in this procedure you no need to be done by you. You just need to switch on the machine and this machine will give the reading. But in this sphygmomanometer you have to record the reading by yourself. This is the manual method, this is the electrical method. Then what we have to do in measuring BP is, what are the important aspects you have to see while measuring BP. These are the things. Patients should sit or lie frequently or quietly for at least 5 minutes before the measurement is taken. Then they have to sit comfortably with the back supported and bared upper arm and legs uncrossed. Legs should be uncrossed. Then the arm should be at the heart level, the midpoint of the sternum. Arm should be in the heart level at the midpoint of the sternum. Then cuff length or width should be 80% by the 40% of the arm circumference. Then the cuff should be deflated at less than 3 mm mercury per second. Then the column or dial should be read to nearest 2 mm of mercury. Then the first audible sound, the sound name is Korotkoff sound. The sound heard during the measurement of BP in the sphygmomanometer is called as Korotkoff sound. The name is coined as Korotkoff. Is the systolic pressure. Last sound is the diastolic pressure. No talking. The patient should not be talking during the procedure between the subject and the observer. Then this is the sphygmomanometer. This is the hand. Then this is the brachial artery. This is the radial artery. This is the brachial artery. For palpatory method, you will be using this radial artery for seeing the palpation using your finger. And here, this is the brachial artery. This is the point where we will see the pressure using the stethoscope, and the cuff will be tied here. Here the cuff will be tied, and using the air bulb, you can increase the meter to up to 200. Then slowly reducing. How you will reduce is, you have to open this wall. By opening this wall, you have to reduce the meter to up to, after coming to 200, you have to reduce the measuring BP. Then the first sound you will be hearing is the systolic sound. Then the second sound you will be hearing is the diastolic sound. This is how you will measure the BP. You can hear the sound by the use of stethoscope and keeping the knob in the brachial artery. Then cuff, how your cuff will be placed and your stethoscope. First you will palpate the brachial artery. Then the lower end of the cuff should be 2 to 3 cm above the antitubular fossa to allow room for placement of the stethoscope. Then pull the cuff snugly around the bare upper arm. Then the phase 1, that is the systolic, and the phase 5, that is diastolic. Korotkoff sounds are best heard using the bell of the stethoscope over the palpated brachial artery in the antecubital fossa. You will be hearing the sound in the antecubital fossa. In which artery you will be hearing sound? That is the brachial artery. Then how you will tie the cuff? Wrap the BP cuff around the patient's bare arm. The cuff should be positioned 2 to 3 cm above the brachial artery. Ask the patients not to talk during the procedure. Then you have to locate the radial pulse. Inflate the BP cuff by pumping the cuff bulb. Then until the radial pulse can no longer be felt. Then you have to note the reading on the dial. Then this figure is estimated systolic pressure. Then deflate the BP cuff and completely, and wait for 15 to 30 seconds to patient to relax. Then traditionally the sounds can be classified into 5 phases. That is, phase 1, appearance of clear tapping sounds corresponding to the appearance of a palpable pulse. Then phase 2, that is, sounds become softer and longer. Then in phase 3 your sound become crisper and louder, you will be hearing sounds so crisply. Then phase 4 sound become muffled and softer. Then in phase 5 sounds disappear completely. In phase 5 what will happen? The sounds will disappear completely. The fifth phase is thus recorded as the last audible sound. Fifth phase is the last audible sound. Then this is the sound. For 120 you will be hearing your first sound and your sound will be reduced and you will travel across the sound. Then where your sound stops is the diastole. So 120 by 80 is your BP. So this is the recording sound. What is the first phase sound? Will be tapping sound, and the second phase sound will be a soft swishing sound, and the third sound is this crisp sound. Then fourth is the blowing sound, and the last, after the last sound is the silence, that is your relaxation phase, that is 15 to 30 seconds is your relaxation. Then coming on to the physiological and pathological variations, in which all the condition you will be having a variations, that is there will be a minimum of variation or maximum of variation. In what all? In physiological condition, that is in which phases is age, sex and body build, and diurnal variations and after meals, and during sleep there will be a variation. Then in the emotional conditions and after exercise there will be a increased variations. And in the pathological variation means in the diseased condition, what are all the disease? Main disease you will get in the BP alteration is the hypertension and hypotension. Hypertension means increase in BP, hypotension means decrease in BP. Then importance, why you are knowing blood pressure? Importance of blood pressure, that is indication of cardiovascular health. We know the cardiovascular health, mainly how is your cardiovascular health. Then essential for adequate tissue perfusion. Then abnormal BP influences risk of heart disease, stroke, kidney failure and mortality. This is the main reason we are seeing the blood pressure regularly. Then how you can measure blood pressure, what all the formula? In tissues what is happening is force with which the heart pumps the blood, what all the force it is giving. Then resistance offered by the vessels. Then what is the formula for finding out is BP is cardiac output into pulse rate. Cardiac output is amount of blood coming out from the ventricles for 1 minute. Pulse rate is the pulse defined by the body in 1 minute. Then what are the factors maintaining blood pressures? These are all the factors which will help to maintain the blood pressure. What all the thing is? Central factors and the peripheral factors. What are the central factors which are pertaining to the heart is cardiac output and heart rate. This is the two main factors which will help the body to maintain its normal blood pressure. Okay, then what are all the peripheral factors? Peripheral factors which are pertaining to the blood and the blood vessels. Central factors for the pertaining to the heart, but for the peripheral factors it is pertaining to the blood and the blood vessels. What are all the peripheral factors is peripheral resistance, body volume, venous return, elasticity of blood vessels, velocity of blood flow, diameter of the blood vessels and viscosity of the blood. These are all the 7 factors, peripheral factors which will be pertaining to the blood and the blood vessels. Then determinants of blood pressure. How will you determine the blood pressure? You can determine by the various multiple factors. What is main thing is cardiac output. Cardiac output is the amount of blood pumped by the heart per minute. Then how will you define cardiac output is heart rate into stroke volume. Stroke volume means what? Stroke volume is the amount of blood pumped by the heart per second. Heart rate is palpation for 1 minute. So these both will help to the for determinants of blood pressure. Then peripheral resistance. Peripheral resistance is the resistance offered by the arterioles. In this vasoconstriction, when the arterioles are in the vasoconstriction state, there will be high in BP. When it is in the vasodilation state, there will be low in BP. Then blood volume. Blood volume, more blood in circulation increases BP, hemorrhage or dehydration decreases BP. Viscosity of the blood will, increased viscosity will raise the BP, decreased viscosity will reduce the BP. Then elasticity of arteries. Healthy elastic arteries dampen pressure. Loss of elasticity causes systolic hypertension. Then how will you regulate blood pressures? There are 3 kinds of receptors which will you help the regulate the blood pressure. What are it is? baroreceptor, chemoreceptor and renin-angiotensin mechanism. These three help in the regulation of BP. First we will see the baroreceptor. See, these are all the classifications, short term and long term. In short term you can use this baroreceptor. What will come under this is baroreceptor reflex, hormones and chemoreceptor reflex. Then long term, in long term which will help for regulation of BP is renin-angiotensin aldosterone system. Then regulation of blood pressure. BP regulation involves short term, intermediate and long term. There are three types in regulating BP. Then in short term regulation it will come under baroreceptor reflex. Then in baroreceptor reflex located in the carotid sinus and the aortic arch. Baroreceptor is located in the carotid sinus and the aortic arch. It detects the stretch that will send the signal to the cardiovascular centers, that is vasomotor centers. If BP rises, it will reduce the heart rate and it decreases the vasoconstriction. After going the reflex to the vagus nerve, it will reduce the heart rate and it will decrease the vasoconstriction. Then if the BP falls, it will increase the heart rate and increase vasoconstriction. These are all the two inversely proportional mechanism. Then this is the baroreceptor flow chart. See, when there is increase in blood pressure, there is stretch of the carotid sinus, that is activation of baroreceptor. When your blood pressure is increased, automatically you will give a signal, your body will give a signal to the baroreceptor. So baroreceptor, what will they do is, they increase the discharge in the 9th and the 10th cranial nerve, that is glossopharyngeal and the vagus nerve. That will stimulate the NTS. So nerve centers, that will stimulate the NTS. Then what will happen is, there will be activation of the vagus nerve and inhibition of VMC, vasomotor center will be inhibited in the BP. But when increase in BP, there will be inhibition of vasomotor. When there is decrease in BP, you will stimulate the vasomotor. Then when you activate vagus nerve, it will decrease the heart rate. So simultaneously your cardiac output will be decreased, that will decrease the blood pressure. Then when you are inhibiting the vasomotor center, it will inhibition of sympathetic outflow. That will decrease the myocardial contractility, that will lead to the vasodilation. So there is decrease in blood pressure. Now you can understand how you can decrease by vagus nerve and how you can decrease by inhibition of vasomotor center. Then chemoreceptor. Chemoreceptor also, it is located in the carotid and the aortic bodies. So it responds to, mainly chemoreceptor will reflect on the oxygen and carbon dioxide level. When there is low oxygen and the carbon dioxide level in the plasma, responds to low oxygen and high concentration carbon dioxide level and high heart rate. Then stimulates vasoconstriction and increase respiratory rate, that will raises the BP. Then autonomic nervous system, that is sympathetic stimulation, it will increase heart rate, contractility and vasoconstriction, that will lead to increase in BP. Then parasympathetic, that is vagus, it decreases the heart rate and decreases the BP also. Then this is the chemoreceptor. Chemoreceptor, what will happen is, stimulation of the chemoreceptor by plasma oxygen. When plasma oxygen level is low, that will lead to the stimulation of respiration. So what will they give out is, carbon dioxide is washed out, that will lead to the respiratory alkalosis, that will lead to decrease in hydrogen concentration in the brain interstitium, that will lead to the inhibition of CIC, that will lead to the increase in heart rate. So when BP reduces, you can increase when plasma oxygen level is reduced, you can increase by stimulation of chemoreceptor. Then in the stimulates the lung stretch receptor, it will stimulate the lungs to stretch. Then vagal afferents inhibits CIC. By that also you can increase the heart rate. Chemoreceptor for increasing the heart rate, that is to get to the normal BP level. Baroreceptor is for reducing the BP level. Then intermediate regulation, minutes to hours, that is hormones. We have seen, no, there are three types, baroreceptor, chemoreceptor and hormonal. Now we are seeing about the hormonal mechanism, adrenaline and non-adrenaline. It increases the heart rate and vasoconstriction. Then angiotensin, what will help is angiotensin 2, it is a powerful vasoconstrictor, and aldosterone, it increases the sodium and water retention in the body. So then in ADH, vasopressin, it enhances water reabsorption and vasoconstriction. Then capillary fluid shift, it is the important mechanism of fluid between the blood and the interstitial space buffers BP changes. It will lead to difference in BP also. Long-term replication. These are now we have seen is the long-term and rapidly acting mechanism. Now we are going to see in the long-term regulation. How will you regulate BP for a longer term? This is in this we have seen is the RAS mechanism, that is renin angiotensin aldosterone system. It will help in the activated when BP or blood volume falls, leads to vasoconstriction, sodium and water retention and increased blood volume. If there is increase in blood volume, there will be increase in cardiac output. Then renal mechanism. Kidneys regulate blood volume through urine formation. How kidneys regulate blood volume? They will be regulating the blood volume through urine formation. It increased BP will be due to because of more urination, that will lead to reduce in volume. Decreased BP, there will be less urination, that will lead to retained volume. See, this is the renin angiotensin aldosterone mechanism. So what is happening, it is there is a hormone angiotensinogen. So that is secreted by the thyroid hormone, then corticosteroids and estrogens. Then that will lead to the formation of angiotensin 1, that will lead to the formation of angiotensin 2, then AT1 receptor, then aldosterone. So what will happen is, it will lead to the vasoconstriction, increase in blood pressure, endothelial dysfunction and increase in oxidative stress. So what all the second thing it is doing is, it is increasing the effective circulating volume, increase in blood pressure, endothelial dysfunction, increase in arterial compliance and increase in oxidative stress. It will also leads to increase in inotrophy, increase in chronotrophy, increase in collagen synthesis, increase in oxidative stress and increase in collagen synthesis and increase in oxidative stress also. Then as per we have seen is the how will you regulate, how will you measure, then what are its factors affecting BP, then how are you regulating. So when there is a increase in BP, now we will see the complications, that is hypertension. This is the pathological factors. Hypertension is the high blood pressure. When your blood pressure is above the normal level, that is your normal level will be 120/80. When it exceeds the 140 and 110 mm per Hg, this is the disease you will get, that is hypertension. You are hypertensive, that is mean by that. Okay, hypertension or high blood pressure, it is a common chronic medical condition. Chronic means long term. Chronic medical condition where the force of blood pushing against your artery walls is persistently too high. When it is too high, it is called as hypertension. It is also a silent killer. So sometimes you can get cardiac arrest also by this disease. When you are having high blood pressure, there will be sudden cardiac arrest. Increases the risk of the serious health problems such as heart attack, stroke and kidney disease. Mainly it will lead to, main common thing is heart attack. Then it will lead to stroke. Then it will lead to kidney disease. So students, hypertension is the silent killer. Then when you are having high blood pressure, which are the natural 10 foods you can control. So when you are regulating weight loss, when there is weight loss, you can reduce BP. Then when you have a healthy diet, that is mainly DASH diet, you can improve your blood pressure. Then when you take fruits and vegetables, then low fat dairy foods, that is milk products. Then moderate alcohol. Then quality sleep, you need at least 7 hours of sleep daily. Then exercise, that mainly 30 minutes plus daily. Then try walking and cycling and HIIT strength exercise. Then less sodium intake. Aim up to less than 1500 milligram per day, less sodium intake, that is salt intake. Avoid processed food, use herbs. Processed food means that is packed foods which are available in the shops. You should avoid that because there will be increase in salt content in that. So main thing is you should avoid smoking. Immediate BP will decrease and better vascular health. When you avoid smoking, there will be immediate BP decrease and better vascular health. Then stress management. Try mindfulness, yoga and support groups. When you are having a support groups, you can reduce the stress, thereby you can regulate the blood pressure, you can reduce the hypertension also. Then supplements. If these are all the things you cannot control, you can control by supplements. Along with this, you have to try this also, but you can take the supplements according to your doctor's prescriptions. What all the supplements you can take is magnesium, calcium, potassium, garlic, then arginine. Then combine multiple steps for best results. Means you can, when you follow these 9 steps, you can gradually reduce the BP. When you take supplements also, you can gradually reduce BP. Then home remedies. What are all the home remedies for high blood pressure? Less salt intake, mainly less salt intake in your food. Perfect sleep, eat potassium rich foods. Then honey and cinnamon you can take. Then you have to monitor the blood pressure regularly. Then you can take the lemon water, lemon filled with water. Then you can eat garlic. And you can reduce the stress. You can reduce the stress by when you are having a perfect sleep. Perfect sleep pattern will automatically reduce the stress. Then you can also reduce the blood pressure by weight management. Weight management, when you calculate your BMI, that is your height by your weight. When you control your BMI, your blood pressure will also reduce. It is also one of the factor how you can reduce BP. So if weight is more, your fat content will also be more. That will also lead to the increase in BP. So when your weight is controlled, your fat control will also be there. Then your pressure will also get down. Then causes and risk factors. How high blood pressure is caused? It is often not identifiable. You cannot identify if you are having high blood pressure also. If you are having low blood pressure also, you cannot identify until you have the symptoms. So how you can tend to develop gradually over time due to a combination of genetic and environmental factors. Blood pressure you can also get by genetics, that is from the genes, and environmental factors. These are all the other factors we have seen before. By that also you can get increased blood pressure. Then what all this is the primary blood pressure. Then what all the secondary hypertension is caused by underlying medical condition or certain medications. What are the common risk factors? That will include is age. When your age is increased, your blood pressure will also be increased. Your risk is also increased with age also. Then family history or genetics. When your family genes are having a BP, you can also tend to get the BP. Then being overweight or obese more than your BMI. When you are having more BMI, you are under obese condition. Then physical inactivity. You are not doing any work. So by that time also you can get your pressure increased. Then high salt diet, when you are taking high salt in your foods. Then drinking too much of alcohol. Then tobacco use or vaping. Then high stress levels. Chronic conditions like kidney disease or diabetes. In diabetes, gradually your blood pressure is also increased. When your diabetes increases, your blood pressure is also increased. Then management. How will you manage and treat the hypertension? Lifestyle modifications. Mainly, we have seen before that the 10 main things you have to control. If you control that, you can maintain the blood pressure. Then eat a healthy diet. Adopt eating plans like DASH diet. You can follow DASH diet, which emphasizes fruits, vegetables and whole grains while being low in low saturated fat and cholesterol. Then result in reduce in salt intake. Aim for less than 1500 milligram of sodium per day for ideal results. Then get regular physical activity. Aim for at least 150 minutes of moderate to intensity aerobic activity per week. Then maintain a healthy weight. That is, losing even a small amount of weight can significantly lower blood pressure. Even if you reduce 1 kg, you will have a variations in BP. That is the meaning. Then limit alcohol consumption. No more than 1 drink per day for men or 2 for men. Then you have to quit smoking. That is, tobacco use damages the blood vessels and it will raise the blood pressure. So you have to quit smoking. Then manage stress and get enough sleep. High stress and poor sleep habits can contribute to high blood pressure. Then what are all the medications? Medications, mainly you have to consult the doctor. You should not take medicines on your own. Mainly you have to consult with your doctor for your high blood pressure. If lifestyle changes are not sufficient, a healthcare provider may prescribe medications to help control blood pressure. Common types of blood pressure medications are diuretics, ACE inhibitors, beta blockers and calcium channel blockers. Regular monitoring of blood pressure is essential for early detection and effective management. You can use the US blood pressure validated device listing VDL to to find an accurate home monitor. You can use the home monitor machine, that is automatic inflated cup. By that also you can measure the BP on your own. Next we will see about the hypotension, that is fall in BP below the normal range is called as hypotension. That is your normal level is 120 by 80. When you are getting below that, that is plus 10 or minus 10 it's okay. When you are getting below that, it is called as hypotension. Hypotension or low blood pressure is a condition where the force of blood against the artery walls is too low, which is, that is the force of the blood on the artery walls is low. That time you will get the hypotension, typically below 90-60 millimeter mercury. When you get below 90-60, it is called as hypotension. It may cause dizziness, fainting and fatigue. This is the major symptoms you will get. Mainly fainting. When you are having low BP, immediately you will fall down. And if severe, may lead to inadequate blood flow to the vital organs also, that is heart also. Causes range from dehydration and pregnancy to heart conditions and certain medications, mainly dehydration. Mainly students who does not take morning food will be affected by the hypotension. Then symptoms, what all the symptoms you can get when you are having low BP. Many people with hypotension have no symptoms, but common signs include dizziness and lightheadedness, fainting, that is syncope, suddenly you will faint, fall off. Then nausea, you will be having a feeling to vomit. Then blurry vision, you will not see the vision properly. Then fatigue and weakness, you will be always be under weak condition. Then cold and clammy skin, your body will be in cold condition. Then fast and shallow breathing. Fast and shallow breathing means you will be breathing too fast. Then what are all the causes? How are you getting hypotension? Hypotension can be caused by variety of factors including dehydration. This is the main first factor you are getting hypotension. Dehydration, not drinking enough fluid can lower blood pressure. You are not taking enough fluid, not drinking water at all, you have a dehydration. Pregnancy, blood pressure often drops during the first 24 weeks of pregnancy. During pregnancy mainly you will not having a tendency to eat, so your blood pressure will be reduced in that condition. Then in heart conditions, problems with heart's ability to pump blood can lead to low blood pressure. When your ventricles, auricles fail to pump blood, you will be having a low in BP, that will lead to hypotension. Then medications, how will you treat hypotension? Certain drugs such as those for high blood pressure, that is Parkinson's disease or depression, can cause hypotension. Mainly in Parkinson's disease or in depression condition, you will be having a hypotension. Then endocrine problems, issues with the thyroid or adrenal gland can be a factor. Then autonomic neuropathy, this is a disorder. This is a problem with the nerves that control involuntary body functions. You cannot control your body functions, which can be caused by diabetes. Autonomic neuropathy is caused by diabetes. These are all the post hypotension, types of hypotension. What is this is? Types of hypotension, what is the first type is orthostatic hypotension, postprandial hypotension, neurally mediated hypotension, multiple system atrophy with orthostatic hypotension, vasovagal syncope, hypovolemic hypotension, medication induced hypotension, then shock you can get, then secondary hypotension. Orthostatic hypotension means what? Orthostatic hypotension is when you are sitting in a normal position. When you are getting up suddenly, you will be having a tendency to fall. That is, you will be getting a giddiness. That type of hypotension is called as orthostatic hypotension. That is a sudden drop in blood pressure that occurs when standing up from a sitting or lying position. Suddenly when you stand, when you have a giddiness to fall, that is called as orthostatic hypotension. By that time itself, what you can treat, how you can treat that patient. How you will treat is, you should change to them to that supine position with the head below the heart level and leg raised. This is the position. By this position you can immediately relieve the hypotension, that is you can reduce the giddiness by changing them to this position. When you are standing, when you make them to lie down and make them to raise the leg, immediately your pressure will come back to the normal. Then in postprandial hypotension, that is after the surgery. a drop in blood pressure that happens within 2 hours after the treatment. This is the common. For every individual you will get this postprandial hypertension due to sudden stress or surgical stress, that and all. By that you will get a postprandial hypertension. Then how will you treat? How will you treat hypertension? Mainly you can increase the BP by increased fluid intake. Drinking more water can help if the dehydration is the cause. If dehydration is the cause, you can increase by increasing the fluid intake. Changing medications. If a medication is causing this issue, a doctor may adjust the dosage or switch to a different one. If your dosage is not enough, when you're taking medicine is also enough, you can change the drug. Your doctor may change the drug dosage or change the drug also. Then what are all the lifestyle changes we can do? Wearing compression stockings, for example, can help some people. Then medications. Medications in some cases a doctor may prescribe medication to raise blood pressure. So you are having a low blood pressure, so your doctor will be prescribing the medicines for increase in blood pressure. This is the mechanism. Thank you for listening, students.